Hello and welcome to Consulting Room 5 with me, your host, Dr. Sue. You know that hygiene, particularly oral hygiene, plays an important role in our overall well-being. Proper dental care not only ensures a bright and confident smile like I'm smiling, but also contributes to our general health. To shed light on this matter, we have a very beautiful, young, intelligent, and popular dentist. You do not want to miss this episode. Stay tuned. Welcome back. You are in Consulting Room 5. We have a distinguished and renowned Ghanaian dental surgeon and a public health consultant. She practices as Charisma Dental Clinic in Accra, also as an ambassador for FDI World Dental Federation's World Oral Health Day and other companies. She has also won many awards, such as graduating as the best overall student during her time at KNUST. She won an award at the Ghana Outstanding Women Award as the Outstanding Woman in Health in 2021. She was the Health Personality of the Year at the 2022 Women's Choice Awards Africa and many other awards. We have with us nobody than a beautiful dentist, dental surgeon, than Mrs. Bim. Mrs. Bim. Okay. Welcome, Dr. Louisa.
Thank you so much.
I always find it difficult to mention your
My
surname.
surname is very easy. Just take it two at a time. Satekla. That's it.
Dr. Satekla.
That is it.
Ah, I got it right. You said we should brush our teeth.
Yes. Very, very, very important. Very important.
Oh, wow. So what are the benefits?
So there are so many benefits, as you can even basically know from our interaction. If you haven't brushed your teeth this morning, I don't think I can be sitting so close to you. So one of the important things that we need to know is that this is even for our people skills, you know, our day-to-day interaction with people, just so that we can live, you know, happily and in a more tolerable way with people that are around us, and also for our health. A lot of people think that brushing just once a day is enough, and we'll talk about that later in our conversation, but there's so much that oral health is linked to in terms of our overall health, and we tend to overlook this sometimes, but there are so many linkages with our oral health and our overall well-being, and so it's very important that we take good care of our oral health.
Are there any guidelines for oral health?
Yes.
Daily guidelines?
Yes, right. Yes. So the basic ones that we all know is brushing twice a day, but it's not just about brushing
twice a day.
Yes.
Morning and evening, morning and afternoon, night.
Morning and night. If you would like to brush in the afternoon, that's very welcome as well, especially people who have braces. We ask them to brush after every meal. So depending on your case, your dentist may recommend that you brush more than twice a day or twice a day. So but the least number of times you should brush is twice a day.
Twice a day.
Yes.
So can I brush 5 times a day?
Well, that depends on your case if you want to. But the thing is that it's the technique that matters. It's not necessarily the frequency. So I actually brought a model here that I would use to show us
I have seen
the technique. Yes, because people feel like the harder they brush, the better the results. But it's not necessarily how hard you brush, but it's the technique that you use to brush that gives you, you know, the
So the
best
guidelines,
results.
the first one is brushing at least twice a day.
Yes.
Yes.
The second is flossing.
Flossing.
Flossing is very important. It's a part of our oral health care routine that many people do not know about, and those who know underestimate the importance of flossing, because you realize that when you brush, your toothbrush can reach the front and then the back of your teeth, and then for the back teeth it also covers the top part. But there's the area between two teeth. So if there's one tooth here and one tooth here, the area between them, the toothbrush can't fit in there, and that's the job of the floss. So like
the area.
Yes.
Between here.
Exactly.
Okay.
The toothbrush can't get there.
The toothbrush, yeah, it just rubs it.
The front and the back. So the floss goes in between, and then you'll be surprised what comes out from there when you brush, because especially for people who have spaces, food tends to get stuck there. And when you brush, you think you've done a good job, but there could be some meats hiding in there. There could be particles of food hiding in there. And when you floss, it takes that out. So that's also a very, very important part of our healthcare routine. And then also going to see your dentist. is very important. We recommend that at least twice in a year.
So we take it one at a time. You said the guidelines. The first one is brushing at least twice.
At least twice
So
a day.
I want you to tell us or show us how we should brush it.
Sure.
Then the next one is the floss. You teach us how to floss.
Okay.
And then visiting the dentist.
Absolutely.
Yeah.
That works for me. So this is a model representing your teeth.
Right.
And so when you open your mouth, you have your tongue, you have your lower set of teeth, and then the upper set of teeth. A lot of people are used to brushing this way. And this is not the recommended way.
Front, back,
side to side.
Yeah,
that is not the best way. You're supposed to angulate your toothbrush at a 45-degree angle to your gum line. So it's not supposed to be straight like this.
Angles have come inside.
Yeah, it's just picture it like you're tilting it a little bit this way, so that when you're going round, you're not going like this. You're going round.
Okay.
So when you go round, if there's anything stuck in between the gum and then the tooth, you're able to get it out. So you're going round, and at the same time, you're bringing it out. So you're going in a circular motion. And I mean, it depends on you. You can decide on how you want to go. If you want to go all round at the front and then open and go all round at the back, or you want to do all the left side, you want to do top and bottom before you go to the other side and do top and bottom. Just do it in a systematic way that you won't forget to brush maybe this side. It's up to you. If you want to do all of this side before you go to all of this side and then do the front, it's all up to you. But just go in a circular motion and not from side to side, because when you do this, you tend to cause wear to the part of the tooth closer to the gum line, and then your tooth will start getting sensitive over time. You can't drink hot fluids, cold fluids, and things like that. But when you go this way, it works.
Does it take the plaques off?
Yes, this takes your plaque off your teeth.
How many minutes should we brush our teeth?
Ideally 2 minutes.
2 minutes?
Yes.
You go 120 count and then it's done?
Not the count, but you should just make sure that you cover every part of your teeth. Okay. And ideally 2 minutes should be enough time for you to cover all the parts of your teeth, and not forgetting your tongue. Another very important part.
Does it cause the smell, the odor?
Yes, the tongue is a very, very important part. It has a very important part to play in bad breath, because you know the back of your tongue has some deep grooves and crevices, and this is a perfect hiding spot for bacteria, especially the bacteria that causes bad breath. So if you're not brushing your teeth, you are just allowing this bacteria to continue to grow and expand in colonies. So they have large numbers of bacteria at the back.
Battalions. They'll be like
large battalions, and they are just having a good time at the back of your tongue. And when you open it, they produce gases. We call them volatile sulfur compounds. So these gases is what you would perceive as the bad odor, as the bad odor. When you open up your mouth and you talk, then it comes out, and then people perceive it as bad odor. But once you're brushing your tongue and you're getting all of these out, then you're reducing the load there, and then you don't have that challenge. There are also other causes of bad breath, but like you're saying, the tongue is one place that harbors these bacteria a lot. And also, even with flossing, because imagine, like I said...
We'll come to the flossing. Yes. I want us to really concentrate here.
On the brushing.
With the tongue, some people... You hear some sound. When they put the brush in the tongue at the back there, some people vomit.
They gag.
Even the gagging is just so loud and irritating.
Yeah, some people have a very strong gag reflex.
Okay.
And so with people like that, we ask them to not go so aggressively. Start from the front.
Okay.
Go bit by bit, bit by bit, and then just gradually go to the back. Don't all the way just go straight there, because it will initiate a gag reflex. And subconsciously you realize that you're not even brushing the back of your tongue, because you know that once you go there you gag. So you just start from the front bit by bit, and then you gradually go to the back and get all those
final question on the brushing. I would want you to demonstrate how we should do it. Should we go 1, 2, 3 up to, let's say, 20? You do here, you do the back, because some people just brush the front, the back, forgetting the top here and even the gum. So
yes, so that is exactly what I was talking about earlier, with going in a systematic manner that you are comfortable with. I may do this side and then come to this side and come to this side, and that may not be realistic for you, depending on even if you are right-handed or left-handed. If someone is left-handed, this is their predominant hand, they tend to brush this side more. So when you know that, you should make it an effort to not only focus on this side, but also come to this side and then brush as well. So whatever it is, whichever route you choose to go, just go in a systematic manner. So you're going round. Let's say we're doing the top. We're going round, we're doing the top. We're going round. We've come to the front. We're going to the left side like that. Then now we come to the bottom. We're doing the bottom. We're going round and round. So we go to the other side. So we've done the whole front part of the teeth. Then you open your mouth, and then you remember to come to the back. So
has it got to do with your being able to go to the back there? Has it gotten to do with your brush, the type of brush you use?
So yes,
because this looks bigger.
Yes, this is a toothbrush to match the size of the mouth.
Okay.
So this mouth is, none of us has a mouth as big as this. So our usual toothbrushes that we have the soft, medium, and then the hard bristle ones. We do not recommend you use a hard bristle toothbrush.
You don't recommend hard bristle?
Yes, we don't. A lot of people think that the harder the toothbrush, the better it cleans. But
or the
whiter the teeth. That is not the truth. It's actually a myth that we are trying to preach against, because it tends to damage your gums and then also wear off the enamel on your teeth. So we recommend you use a soft or medium bristle toothbrush, but not the hard bristle toothbrush. But the soft
ones, when you use them, it doesn't look like you have done anything in your mouth.
It's about the technique.
Okay, so is that why we use the electric? The electric ones go that circular motion?
The electric. So you see, the electric toothbrushes have been made to already go in that circular manner. So you just have to move it along your teeth and along the gum line. So electric toothbrushes are perfect, especially for older people. If you have an older, the aged, exactly, your grandma, your grandfather, who can't really go in there and clean properly. If you get them an electric toothbrush, it saves so much, and then they're able to get the adequate cleaning that they should get.
How do we go down here?
Yes, so you're going to go, don't forget the top, because the top of your back teeth also has these grooves and crevices, and food can get stuck there, and then bacteria will feed on it and give you cavities and all that. So you're going to come out like that, and then brush everything out. When you get here, you're going to move it out that way.
Okay.
So you're getting any food that is stuck behind the teeth out. Okay. Because this is an area where plaque accumulates a lot and turns into calculus. Yes, there's a salivary gland down there. So there's constant saliva coming out. And then there are minerals in the saliva, so it's easier for them to be deposited behind here. Okay. So it's very important to remember to brush this part.
Always brush down there.
Down there, brush everything out, and then you come to this side. Same as the top, you're going to brush this part like this.
So if I don't have a toothbrush, can I use my chewing stick to do all that?
Everybody who is watching us here has a toothbrush.
Really?
I'm pretty sure
I like to use the chewing stick or the charcoal with the plantain and then hit it.
We don't advise, we recommend that you use a toothbrush. However, if you're using the chewing stick, like you're saying, this is what our grandfathers have used over time, and then before the toothbrush was introduced to us, we asked that, okay, if that's what you want to use it with your toothpaste, because your toothpaste contains some minerals like fluoride that your chewing stick does not contain.
Chewing stick is very high in fluoride.
No, so the fluoride that we recommend is in toothpaste is actually measured, and it is something that can be quantified. In your chewing stick, you can't quantify how much fluoride is in there.
You are right. Yeah.
So that is why we say to just cut everything short, and to make things easier for you and I, why don't you just use a toothbrush which has the bristles are not too hard. You're going for a soft or medium toothbrush. You're not causing any damage to your gums. You're not causing any damage to your teeth.
Right.
And things like that. That's why people like me are here today, to educate us.
That's why you are watching Consulting Room 5.
Thank you. So you try and educate your grandma, your grandpa, and say, look, why don't you try this? Try and get them an electric toothbrush. Say, try this out and see. It feels much better. You see, and it's even easier for you.
Let's look at the flossing.
The floss is another way of cleaning your teeth. Like I said, this is what it looks like. We have different types of floss. So we have this type that is
like a thread.
but it's not your regular thread.
So we can't use the one for the hair and sewing
that's
and all
different.
that.
It has a different purpose. This floss was made specifically for the purpose of cleaning your teeth. So this is what it looks like.
Okay.
You're going to
So is it available in
almost every
pharmaceutical shops?
Even in supermarkets, you'll find floss.
Because the ones I know are the ones with the handle.
Yes, and then, those are also on the market. Those are also easier to use for some people. So with that, you just place it in between your teeth, pull it out, and then you're good to go. And they usually have a pick at the end, so that if you want to use that part to pick out anything, you can do that as well. Okay. So this is what the floss looks like. So you're going to wrap it around your finger on one side, and then on the other side as well. So it's going to be like this. Okay. And then you're going to push it up between your teeth. Can you use that on the... So this may not be able to show it properly because the teeth are matted together. But in a real human being, there's a space between that allows you to push it in between. Okay. So once you push it in between, you're going to let it hug one tooth. So don't just push it in and out. When you push it in, you're going to let it hug one tooth and then bring it down so that anything that
bring out the particles,
the particles there, the plaque there, anything that's stuck there is going to slide it out. Then you go in again on the other side and then you slide it out. Is it
a sharp one? Is it plastic or polyester cotton?
No, it's like waxed. They call it like mint waxed. They're different.
So it doesn't cut.
It doesn't cut. You know, it's like your thread.
Okay.
Yes, but if you floss too difficult, like too hard, it's going to damage your gums. You start bleeding. You're not supposed to bleed when you floss. Some people want to floss till they see blood. That's not the right way. That's why we ask you not to push it with force. Gently push it in and then bring it out.
How you have used two of your hands, can it go to the back?
Yes, you can go to the back.
Really?
But if you're a beginner and you're not too used to it, you can get the handheld type that on the stick that
I think that's easier to use.
It tends to be easier for people, but I mean, when you use it over time, you can go to the back and it will still come out.
Yes. Okay. So how many times should we floss?
So usually when you brush, you're supposed to floss so that you've done the whole cleaning process. You've done the toothbrush part and then you've done the flossing part, and also after meals, if you feel like
after every meal.
Yes. Well, we don't say after, not after every meal. It's not practical to floss after every meal. But sometimes, you know, when you eat and you feel like there's something stuck there, instead of going to get a toothpick, which can break and get stuck there as well, use your floss.
So toothpicks are not good to use.
We don't recommend you use toothpicks. If you want to pick something out.
A broomstick.
That's even worse, doctor. Doctor. So, like I said, if you feel like you need to pick something out,
and the meat, this cannot.
That is why the handheld floss is the best, because it has the pointed end, which is plastic, and it's not going to break like your toothpick would break. So you know, because people will come in with swollen gums, and then you irrigate, and you realize that there's a tip of a toothpick that has been stuck there that's irritating the place, making it so difficult for them to eat. So it's better you use your floss
with dental floss like these ones. Or the handy ones that you can just fit in there. Okay, that's perfect. Wow. So we should have our dental floss in the floss in the handbags and in our cars.
I have one everywhere. I have some in my office, in my bag, everywhere. It makes it easier so that you find yourself using your finger in public.
Your tongue.
No, this is cuter when you do this and then you floss. It comes out easily and nobody even knows what just happened.
Okay. So that is about flossing.
Yes.
Okay, and then the next guideline is visiting the dentist.
Yes, at least twice in a year.
So every 6 months, we should visit our dentist.
See your dentist.
Wow.
It's very important.
For us to smile broadly.
Yes.
Yeah.
Some people feel, oh, there's nothing wrong with me. There's nothing wrong with my teeth. Why should I go to the dentist, waste my money, waste my time? But the thing is, here in Ghana, a lot of people tend to come to us when they're in pain.
Yeah.
And by the time you start feeling pain, it's a bit too late. By the time you start to feel the pain, it's a bit too late. That means that the disease process has progressed far too long. You're going to pay more money. You're going to waste more time. You'll be coming in for multiple appointments.
Go through a lot of pain too.
Exactly, and you also go through pain. You're going to miss work hours, school hours, and all of that. Because that problem that you're complaining of could have been easily diagnosed on your routine visits. For example, when you have a cavity starting in your tooth, it doesn't just become a cavity one time.
Right.
It starts as a white spot lesion, which your dentist will spot and see, okay, you have a white spot lesion, which is likely to develop into a cavity or a hole or caca, as we call it here. So when you come in for your routine dental visit, your dentist is able to detect it early and stop it from even developing into a hole or a cavity. But because you didn't have time and because you couldn't come,
the cavity will give you time.
Yes, that white spot lesion has had time to develop into a cavity. And even with that, sometimes you can feel that there's a hole there, just that it's not hurting. For some people, instead of them to come to us and say, oh, I have a hole in this tooth, so please fill it or let's see what can be done, they walk around with the hole, and then over time, the hole starts to hurt. No, sometimes it doesn't hurt from the beginning. It doesn't hurt.
Okay.
Yes. So over time, when it starts to hurt, that's when they come in. But by that time, it's progressed too long, and in some cases, we may have to take the tooth out. Sometimes we can save the tooth by doing a procedure called root canal and all of that. But it's much easier and much cheaper if you come in for your regular visits so that we can spot some of these things very early and then don't have them progressing into a full-blown disease that would
so we should visit the dentist twice every year.
Yes.
So every 6 months.
Every 6 months.
So how do we start? January we go, and then July?
Yes. Okay. That's what most of my patients do, and it's very easy that way so that you don't forget.
Are there virtual ways of visiting? If you can't visit the dentist physically, going to the dentist, can you do
so
virtual?
Teledentistry has started here in Ghana. Pepsodent has started a program like that where you get to talk to a dentist on the phone, and then based on, yes, very cool, right?
I hear you have just mentioned Pepsodent like 2-3 times. You have to pay for it.
No, but it's the only, for now, it's the only platform that is offering teledentistry. And since you asked, I think it's why is that
you would have to bring, I know you are on there, you have something to do with them. You have to bring some ads.
Yes, I do work with them. So
tell them you would have to bring some ads.
I'll do that. I'll send an invoice.
Yes. So how about whitening of teeth? Yes. Scaling?
Yeah. So whitening and scaling are two different things. Scaling and polishing is a routine procedure that your dentist will do for you when you likely go for your appointment.
Okay.
So that is getting
professional brushing.
Yes, that is getting off the plaque and calculus from your teeth. So we all develop plaque on our teeth, and when the plaque is not cleaned on time, it hardens and becomes calculus. And calculus you can't get off with your toothbrush. It has to be cleaned professionally by your dentist. So you see some people have these yellow things in between their teeth, and that is the calculus. When you go to your dentist, you'll be able to clean it for you. I thought
calculus was a mathematic term.
No, we also have calculus in dentistry, or it's also called tartar. That's like the yellowish buildup that some people have between their teeth. So when you go to your dentist, they're able to clean that for you as well.
And then the whitening.
So the whitening is the procedure where you actually want to, it's an aesthetic procedure. So some people, for some reason, may have discoloration of their teeth. And so when you go in and you do the whitening, it makes your teeth appear whiter. And we have the whitening that we do in the dental chair or in the office, and then we have the type that can be done at home. But there are many fake brands on the market. There are many people who are performing these procedures who are not qualified to do that. They are not dentists and they are performing whitening.
How we know these fake ones? And
so whenever you go, you need to ask if the person is actually a trained dentist, because we see a lot of these cases of people who have gone to these people to get the whitening done, and then they have damages on their, a lot of damage on their gums, and they come back to us, and by the time they come, there's so much damage that has been caused. And so you should always make sure that your whitening is being performed by a professional, and then you won't have any
But do you advise we even whiten our teeth at all?
So it's an aesthetic procedure. Once it's done by a professional, you don't have a problem. But if it's done by somebody who doesn't really know what they're doing,
or somebody who is into fashion, you know, now these fashionistas are
then that is where you have a problem, because they are not too sure of the science behind the art.
So how often can we whiten our teeth?
So with that, I can't say it here that everyone should go and whiten their teeth.
No, people who want to whiten their teeth, How often should they do that?
So that would be, your dentist will tell you that based on what exactly he's seeing in your mouth at that point in time. So he can recommend maybe every 6 months or so, depending on what exactly he's seeing in your mouth. We don't have a recommended period of whitening that we can just tell everyone to go and do.
Wow. Wow.
Yes.
Wow. A lot of education in here. You are watching Consulting Room 5. We are with Dr. Bim. You give me one freestyle of your husband's song.
Are you sure?
Okay. That's nice. Okay. Anyway, it's just by the way. But can you give us an overview of some dental diseases that are common to human?
Okay. So with the most predominant one all over is caries, or dental caries as we know it. In Ghana, we call it kaka. And this, as I mentioned earlier, is when it starts by bacteria causing it in your mouth. So when you have sugary foods that we eat, these bacteria feed on the sugary foods and then they produce byproducts. And these byproducts are acidic in nature. So just like how humans eat, we take in food and then we excrete the waste. That's the same thing that happens with the bacteria. They feed on the sugars that we eat. And the waste that they excrete is the acids. They are the acidic compounds. So these acids, you know how acids work. They wear down and they damage the tooth surface. So over time, it demineralizes the teeth. It takes out the minerals out of the teeth and makes the teeth very weak. And then it caves in and causes a cavity that you see as a hole in your tooth. So that is how the whole disease process starts. When it ends up as a cavity, you can come into the dentist clinic for it to be filled for you. If you don't come in, the bacteria to continue to progress through the second layer of your tooth into the third layer, which is the pulp. And that's the part of the tooth that has the blood vessels and the nerves. And once it gets there, you start to feel pain.
Okay.
You can't sleep
But when
at
you
night.
visit the dentist early, by the time you get there, they will detect.
Exactly.
And it
will not travel to the third layer of the tooth where you start to feel pain and sensitivity. So if you're able to catch it early, it doesn't progress all the way down. But in some cases, people wait, they have the toothache. And even with people experiencing toothache, some of them would start to apply herbal preparations, take painkillers. Taking a painkiller is only stopping you from feeling the pain, but it's not stopping the process. At that moment even. Exactly. It's not stopping the process. So the bacteria will continue working and traveling further down. You develop an abscess because the infection is still going on. So it continues to travel. You get a big swelling over there. And then that's when you see people coming into the clinic with a big abscess. By that time, it will be late. Yeah, and people actually lose their lives because sometimes it becomes a spreading infection. You can have Ludwig's angina, where now it's spread all the way, fasciitis. It's very, very sad that you see people losing their lives from something like this, which could have easily been stopped early in the early in the course of the disease, but they wait for it to get this bad. So, I mean, caries is one of the main oral health diseases that we find. Also, gum disease. And this also stems from the plaque accumulation that I spoke about. And you see that you are brushing your teeth and you are bleeding. People feel like, oh, I need to start seeing blood before I know I've brushed my teeth. It's not normal for you to see blood when you're brushing your teeth. It's like going to take a shower and you say, oh, me, every time I bath, I bleed. I need to see blood before I stop bathing. That is strange. That is not right. So once you're bleeding, it means your gums are inflamed. You need to go and see your dentist to have a professional cleaning done. And gum disease can also translate into many other things. Bacteria that is thriving in the gum disease that's going on can spread to other parts of your body, and there's research has shown that there are links to that and erectile dysfunction in men. The men in here are saying, "Hey, yes, it's true." So it's very important. You don't take these things for granted. That you don't take it for granted at all. Sounding the alarm and saying, "Look, don't take these things for granted," because it starts an inflammatory process all through your body. Wow! And you wouldn't even notice that is what it is. So it's very important. You will not be able to link that. Yes, it will never even occur to you. Right. Exactly. But research has shown all this. It's not me saying it. It's research. It's research. You can go online and find all of this information. And then also bad breath is another big issue. And a lot of people are battling with it, and they can't really tell what exactly is causing it. Because they say, oh, doctor, but I brush twice a day.
But you know, doctor, you just pause there. Sometimes some people, their mouths are closed, but the breath coming from their nose is even smelling. So what's the cause?
So there's so many causes of bad breath. And we work closely with the ENT surgeons on this, because bad breath has intraoral and extraoral causes. So 80% of bad breath is usually coming from the mouth. But there are some cases that it's coming from somewhere other than the mouth. It could be coming from the gut. It could be coming from your sinuses. It could be coming from your tonsils. So it's very important to go to your dentist to find the cause of the bad breath.
Okay.
Because sometimes it could even be kidney disease that is causing the bad breath, but you'd be thinking it's your mouth.
And you'll be brushing that
you buy all the toothpaste and cry, and it's still not helping. And your dentist, because he or she is trained to detect the type of bad breath and then what could be causing it, can tell you that it's likely you are suffering from kidney disease. And then they'll do the test, and really you do have, there have been cases that like that, patients where we've detected that, okay, this is something called the ammonia breath, which is synonymous with kidney disease, and you find that that is what is happening.
If someone has a bad breath, will the person be able to tell herself?
A lot of people can tell. Some people come in and they report that they sense that they have bad breath. Some also say that, you know, people who are close to them, like their partners or their friends, have told them that they have bad breath. So it depends. Some people are able to tell by themselves that they do have bad breath.
Wow. So we should visit the dentist twice a year, at least 6 times. And we should brush at least twice a day. We should floss. And we should rinse our mouth after each meal. You said that?
Yes. So you're not supposed to brush immediately after eating. That's another mistake that a lot of people do.
Okay, immediately after eating, you don't have to brush your teeth.
You don't have to brush.
Okay.
Yeah, so what you do immediately after eating is to swish and swallow. So if the water you are drinking, you can put some of that in your mouth, swish, and then you swallow.
You swallow that.
Yes, there's nothing wrong with that. And then you wait about 30 minutes after eating before you brush. And the reason for this is that every time you eat, your teeth goes through a demineralization and then a remineralization process. So if you're brushing immediately after eating, the minerals have sort of seeped out of your teeth. And so you're brushing your tooth in this most vulnerable state, and then you're weakening the teeth. You're wearing off the outer layers of your teeth. So we say wait after 30 minutes. By that time, your teeth would have remineralized, and then you can brush your teeth.
Wow. Very good education. So how about people who leave the paste with the foam in their mouth for some time, and in the gum before they spit it out?
Yes, so it depends. Really, for that, some recommend that you brush and then just spit. Don't rinse your mouth. Usually, it's easier to do that at night because you're going to sleep. But when you have business to do, walking around in the day, for some people, it's a bit uncomfortable.
Okay.
So you can still rinse your mouth and then go about your activities. And then in the night, when you brush, you can just spit and not rinse your mouth, and that's fine.
Wow. Doctor, you are really teaching us a lot. You are educating us. Thank you so much. Can you tell us a bit about World Oral Day?
Yes. So World Oral Health Day is celebrated every year on the 20th of March.
World Oral Health Day.
Yes, World Oral Health Day.
Okay.
And this is by the FDI World Dental Federation.
Okay.
So every 20th of March, all over the world, everybody is celebrating World Oral Health Day.
Should keep our mouth smelling good.
Yes. This is an opportunity for us to create awareness about the importance of oral health, because you'd agree with me that a lot of people don't really highlight or know the importance.
Right?
Exactly.
Ghana Dental Association.
Yes.
World Oral Health Day, 20th March.
Yes.
Wow.
Yes.
Okay, so tell us about that.
Yes. So this is an opportunity for us to create awareness about oral health and the importance of oral health. You'd see a lot of clinics offering discounts for dental cleaning, dental appointments. Yes, 20th March. So keep that date down. And even actually throughout the whole of March, for example, at Charisma Dental Clinic, we're offering free consultation.
Where she is? Yeah.
Yes, we're offering free consultation throughout the whole of March when you come with the code, WOHD25. So whenever you come in,
WOHD25. So like World Oral Health Day 25.
So when you walk in and you say, okay, I'm coming for consultation with the code WHD25, you're going to get free
the whole of March.
The whole of March.
Okay.
So many clinics are offering this, and this is an opportunity and a way for us to...
Charisma Dental Clinic.
Yes, Charisma Dental Clinic at Osu on the Oxford Street.
On the Oxford Street.
Yes.
Okay. When you go, just use the code.
Yes.
World Oral Health Day 2025. 25.
Yes.
Okay.
Yes, and you have free consultation. And this is a way, a little way of giving back and also encouraging people to come in.
Can my viewers also get some discounts? Maybe they can say Consulting Room 5. And
yeah, we can work something like that out. So when they come, they should just say Consulting Room 5 and we'll see what we can do.
Dr. Sue.
Dr. Sue,
and then they are there.
Yes. Yes,
Okay.
so I mean, World Oral Health Day, I'm sure if you come on social media and you even type in World Oral Health Day, you see the different activities that are going on all around the world. There are free dental screenings going on around, education, oral health education in different schools and things like that.
What's the theme? Can you?
So this year, the theme is a happy mouth, a happy mind.
A happy mouth.
Yes.
A happy mind.
Yes.
How can my mouth be happy?
So we spoke about this earlier. The fact that oral health is linked to your overall well-being.
Okay, yeah.
So when you have a mouth that is happy, your mind is also happy.
Okay,
You're
so
not thinking
I was thinking that because we use our mouth to smile.
Yes.
So if you smile more, you're happy.
That is right.
Yeah.
You're very right. There are different ways that you can interpret it, and it makes a lot of sense because it intertwines with different parts of our lives in different ways that sometimes we don't even realize. So a happy mind, one of the ways to achieve a happy mind is to have a happy mouth. That's basically what we're saying.
A happy mind.
A happy mouth, a happy mind.
A happy mouth.
Yes.
A happy mind.
Yes.
We smile broadly.
Yes.
Happy mouth.
Yes.
Thank you so much.
So there are lots of activities that you'll be seeing.
Okay.
This
we
month.
should look out for.
Yes, especially on the 20th of March. Yes.
Okay. Okay. But the whole of March, I'm concerned about the discounts. The whole of March, we have a discount at Charisma Dental Health Clinic.
Yes.
And you go there, you use World Oral Health Day 25, you get a discount. You use Consulting Room 5, you get a discount. Discount on what? Scaling.
So that when you use the code WHD25, you're having free consultation. You're not paying anything at all for consultation.
Okay.
But now you and I are trying to figure out something.
We are doing a negotiation.
We're negotiating for your viewers, so we can see what we can do for them. So we'll talk about that. When they come, they will know the results.
They should just mention Consulting Room 5 with Dr. Sue, and then they'll get a discount.
Exactly.
They will get a discount.
Oh, they will. They will.
Okay. On the Oxford Street.
Yes, also Oxford Street. It's a green story building. You see us at the top.
At the
says
top.
Charisma Dental.
Okay, that's great. Anyway, thank you so much. You have really educated us. Next on our show, we are going to invite a lady who has a dental health issue. Okay. And so you would maybe kind of talk to her, you interact, and then we see how, because other people who are watching may be having such the same issue. Gloria, you're welcome.
Thank you very much.
Such a calm, beautiful young lady. I hope you are doing well.
Yes, please.
So how often do you visit the dentist?
Not often. I only go to see a dentist when I have issues with my teeth.
When you have issues with your teeth?
Yes.
Why you have an issue with your teeth?
I won't say I do. Doctor is here, maybe she can help me out. But I just don't feel comfortable with the arrangement of my teeth. That's the only thing.
Oh, okay. So like the dental formula, the formula.
Yes.
Or is it a disease? It's not, is it?
So we call it a malocclusion. So we have the different types of malocclusion. Some people are not happy with the way the teeth are proclined, or they are crowded, or they're spacing. So this can all be corrected with braces. We have the clear aligners, and then we also have the traditional braces. And a lot of people don't know that this can be corrected, but in a few months or sometimes years, a year or two, this can be corrected.
At what age can we wear braces before we
So once all your adult teeth come in,
you are
going to go to see your dentist. They're going to take a couple of x-rays and do some assessments. once you fall within the requirements, we fix your braces for you, and then you're good to go.
So Gloria, you visit the dentist because you think your dental formula is not too good?
Yes, please.
And what did they do?
I'm supposed to wear braces, but you know the cost is so expensive, so I'm saving up.
Wow. So you just visit the dentist because you think your dental formula is not good?
Yes, I have like 2 that are coming out, so I feel uncomfortable sometimes when I'm taking pictures. I don't want to smile because I feel weird.
But you're smiling nicely though.
And people tell me I have a nice smile despite the arrangement, so I'm becoming a little bit confident with the way the teeth are arranged.
Oh wow. But when you went to the dentist, when was the last time you went to the dentist?
It's been long.
So it means she doesn't visit the dentist?
No.
From what she's saying, she's not been doing the twice in a year that we've spoken about, so she's suspect.
She is. And how many times do you brush your teeth?
Twice. Morning and evening.
Not because you're unsettled?
No.
No. Oh, I see. That's great. That's great. But do you know Dr. Louisa?
Yes, please.
From where?
She's our mother.
Hey, you know?
Stone is our godfather, so she's our mom.
Stone. Oh, so you follow Stone Boy?
Yes.
I see.
I'm a big fan.
You're a big fan. Oh, I see. I'm also a big fan, but I don't know how to sing any of the songs.
Oh, don't worry. Once you love him, that's it.
So give us one song then. You see how you're smiling. Give us one beam song.
I don't know how to sing like you, but I'll try.
Like me, did I sing? You see, it's beautiful to smile. That's why we always advise that you visit the dentist, because if you are smiling and it doesn't go well, I mean, people will just either close their eyes, cover their nose, and that is not good.
Your smile can be somebody's first impression of you, and they can just like you from just how you smile.
Yeah.
Some people have a beautiful smile, but because they are not confident in their smile, they may have a chipped tooth, or they're not comfortable with the way their teeth are arranged, so they are hiding that smile. And it can easily be corrected.
Let's visit our dentist, Let's visit our dentist twice a year. Give us one beam.
Into the future with you.
Hey,
end of the road. Give me your love and you know you're safe. Baby, never leaving to what you say.
That's nice. It's beautiful to smile. It's beautiful to smile. That's why we have a dentist here, and we have a beam fan, and you have Dr. Sue here. So it's very beautiful to smile all the time. By smiling, you have to visit your dentist twice a year and brush your teeth 2 times at least a day. And also, you have to floss your teeth in between to take off all the particles. We have doctor here. I'm not saying that. It's doctor who is saying it. And also, for you to get that beautiful smile, you should also visit your dentist. Thank you so much, doctor. You said you have a dance challenge for me, right?
Yes, so there's an official song for World Oral Health Day this year called A Happy Mouth, A Happy Mind. And there's a dance challenge.
A happy mind.
Yes, there's a dance challenge for the song. So I think it'll be nice for all of us to do it together. Yes.
Okay, so we are going on commercial break. After the break, we are going to do the dance challenge together. Stay tuned. So welcome back. As you can see me in World Oral Health Day 2025 March. So we have Dr. Louisa, Gloria, and myself. We are going to have this dance challenge done by which people?
Accra Boys.
Accra Boys, yeah. So to commemorate the World Oral Health Day, March 20th, 2025. So we are going to give you the dance, the moves, and everything as you are happy with your mouth and happy in your mind for the theme for World Oral Health Day.
And would actually like to see people hop onto the challenge and then tag us on social media. So as we do it,
in fact, we have to see who wins. So we are going to do that, and then we do the challenge. You put the hashtag there, and you'll be happy, happy mouth, happy mind. Go, Mr. DJ. Go, go,
happiness
go.
everywhere. Happiness everywhere.
Okay.
Happiness everywhere. Cut the sugar, have no doubt. You feel good inside and out. Happiness everywhere. Happiness everywhere.
We did good.
Happiness everywhere.
Happiness everywhere.
Everywhere.
A happy mouth, a happy mind. That's the theme for the Oral Health Day 2025, 20th
Yes.
March. Yeah, so Dr. Louisa is championing this and the challenge goes on. I give it to you, you also do it. Thank you so much for watching Consulting Room 5 with me, your host, Dr. Sue. Visit the dentist and you would never regret. Bye. Thank you.